AIDS, STITB Council, Director General, directors in the Ministry of Health, and other senior government officials present, the United Nations agencies, representatives from the cooperating partners, civil society organizations, distinguished invited guests, members of the press, adolescents, and young people present. Let me join those who have welcomed you to this important occasion. It is indeed an honor for me to be here with you at the Adolescent HIV Sage in Indaba under the theme Adolescent Voices for HIV. The next 2 days have been set aside for our adolescents and young people to look back at our country's HIV response in order to determine its effectiveness as it pertains to them and to adopt high-impact strategies. It will be an opportunity to reflect on successes and shortcomings encountered in the fight against HIV and AIDS, and explore ways in which adolescents and young people can be part of strengthening the response towards elimination of the disease. It is also an opportunity for all of us to show support for any adolescent and young person living with HIV by listening to them on how we can help in ensuring that they have long and fruitful lives. Madam First Lady, distinguished guests, today, Zambia is making remarkable progress against HIV and AIDS. 9 out of every 10 people living with HIV are on life-saving antiretroviral therapy, ART. In addition, our country has also made tremendous progress in scaling up viral load testing to now over 80% coverage from 33% in just 3 years, and 95% national viral load suppression for those on ART. This will essentially translate into reduced HIV transmission from this population to the HIV uninfected individuals. In addition, scientific advances have been made in HIV treatment. There are laws to protect people living with HIV, and we understand so much more about this condition. Despite this, each year in Zambia, 48,000 people are newly infected with HIV. People, particularly adolescents and young people, do not know the facts about how to protect themselves and others. And stigma and discrimination remain a reality for many people living with the condition. At this point in the HIV response, it is imperative that we accelerate our efforts in closing the tap of new HIV infections. Preventing new HIV infections is central to ending the AIDS epidemic. I urge the Ministry of Health, through its coordination mechanisms, to ensure an effective functioning of multi-sectoral, harmonized access and scaled-up quality prevention services to the targeted population such as adolescents and young people. Our government values community engagement in the achievement of results, which answers to the vision of leaving no one behind. While much remains to be done in mitigating the impact of HIV and AIDS, let us continue on the path of eliminating HIV and AIDS with more commitment and dedication. This should be done by making smart investments in our health systems anchored on primary health care. Madam First Lady, distinguished guests, ladies and gentlemen, the Ministry of Health continues to prioritize adolescents and young people's health, focusing on addressing health problems that affect their ability to realize their full potential. These health problems are not limited to HIV and AIDS. They also include sexually transmitted infections, STIs, sexual and reproductive health issues, gender-based violence, GBV, non-communicable diseases, substance abuse, and problems facing adolescents with special needs. Our efforts are aimed at ensuring the health and economic contribution of this potential workforce. Engaging young people in planning, implementation, and evaluation of health programs targeting them has been pivotal in the provision of adolescent responsive and youth-led services. This is the reason we launched the Adolescent HIV Sage campaign last year in December, and are today having the first ever Adolescent HIV Sage in Indaba to ensure that whatever interventions and strategies that are developed and implemented that will target the young people of this country during this SAGE campaign are led and designed by the young people themselves. It is indeed the sure way of achieving and sustaining epidemic control. Madam First Lady, distinguished guests, ladies and gentlemen, we are honored to have you grace the Adolescent HIV SAGE Indaba today, which is anchored by young people who provide useful information from their perspective to strengthen the HIV response and other related health services. As I call the First Lady, I also wish to take this opportunity to urge our adolescents and young people to participate and take a leading role in the fight against the coronavirus disease, COVID-19 pandemic, which has devastated many countries, including our country. It is now my singular honor and privilege to now invite you, Madam First Lady, to deliver your keynote speech. I thank you.
The Honorable Minister of Health, Dr. Jonas, Chanda, MP, Permanent Secretaries and other senior government officials present, National HIV/AIDS STI TB Council Director General, the UN family, representatives from our cooperating partners, the civil society organizations, adolescents and young people present, members of the press, distinguished invited guests, ladies and gentlemen, I am honored and delighted to be part of this momentous occasion, the first ever Adolescent HIV National Indaba. This gathering is extremely important as it is a rare opportunity for different stakeholders to interact with you, the adolescents and young people, who are the recipients of healthcare services. It is clear that the Zambian government values all of you present today. You are the key partners in the main developmental areas of which healthcare service provision is top of the agenda. We hope that this interaction will eventually lead to more adolescents and young people accessing HIV-related services, such as knowing their HIV status and being linked and maintained in care for those that may be HIV positive. Distinguished guests, since the beginning of HIV and AIDS in the early 1980s, the pandemic has continued to be a global health threat to our people. It has also continued to affect our national developmental efforts of transforming our economy, having a direct impact on poverty and inequality. It is therefore my pleasure to address you at this important event under the befitting theme, Adolescent Voices for HIV. This initiative is very cardinal for me as a member of the Organization of African First Ladies for Development, or AFLAD, which is spearheading a campaign to end childhood HIV and keeping mothers alive and healthy, termed the Free to Shine campaign. The Free to Shine campaign, which I was privileged to launch in 2019, complements the Zambia Ending AIDS campaign aimed at ending AIDS as a public health threat by 2030. This calls for effective and robust interventions through a coordinated response that targets an individual using the life cycle approach of addressing HIV prevention and treatment. Particular attention is also paid to those of reproductive age, pregnant women, and children born with HIV. This event that is dedicated to showcase adolescent health services fits in very well with both the Zambia Ending AIDS and Free to Shine campaigns. It has been proven that tailored interventions that meet the needs of a target population have higher success rates than those thrown at the general population. Distinguished guests, It is important to note that in 2016, the Ministry of Health, in its quest to achieve HIV epidemic control by 2020, adopted the UNAIDS 1990 fast-track targets, meaning that 90% of people living with HIV know their status, 90% of those that know their HIV status are on antiretroviral therapy ART, and 90% of those on ART are virally suppressed. Towards the end of 2020, tremendous progress had been achieved, with Zambia becoming the 7th country to attain and surpass its 1990 targets. However, despite these tremendous achievements, the gains in the HIV response have not been uniform across the different age groups. Distinguished guests, in the past 2 decades, great progress in preventing new HIV infections has been made globally in comparison to this decade. The current decade has shown a significant slow pace in reduction of HIV new infections, despite continued and sustained investments in prevention, treatment, and care programs across the 20 high-burden countries, which regrettably includes Zambia. The slow pace at which new HIV infections are declining can be attributed to low comprehensive knowledge on HIV, particularly among those aged between 15 and 19 years, standing at 4 out of every 10 adolescents. This is unacceptably low. Undoubtedly, as a country, we have our own success stories through the multi-sectoral HIV response. These include increased coverage of HIV treatment and reduction of AIDS-related deaths. However, in spite of these strides, I still have great concerns in my capacity as First Lady of the Republic of Zambia, carrying the flagship of the Free to Shine campaign and patron of the HIV Prevention Coalition on the slow pace at which new HIV infection rates are declining. What has been witnessed in the last 5 years is a shift in the epidemic, with about 2 out of 5 new infections being in young people aged 15 to 24 years, and 7 in 10 of these new infections are coming from adolescents, girls, and young women. My dear adolescents and young people, I note with grave concern that the majority of young people who were born HIV-free are getting infected with HIV as they become sexually active. The ambitions of the Free to Shine campaign of born-free and AIDS-free must be turned into reality to prevent young people from HIV infections. Therefore, no one, including myself, should sit on our laurels and watch this trend continue unabated. This is the time that we need to upscale and outscale all HIV prevention programs so that we can markedly reduce new HIV infections. Thus, today's theme, Adolescent Voices for HIV, is timely if we are to reach epidemic control of HIV and end AIDS by 2030. It is an important opportunity to recognize that adolescents need to take the steering wheel when it comes to driving the HIV response. Ladies and gentlemen, adolescents and many young people under 24 years have challenges seeking HIV testing services compared to adults. This is due to various barriers such as inadequate number of skilled service providers for adolescent-specific services, limited coverage of adolescent-friendly HIV services, limited availability of peer support groups, and long distances to health facilities, to mention but a few. It is my hope that this Indaba will address the key challenges that affect adolescents and young people in accessing HIV services in our country. The Indaba should contribute to empower young people have access to accurate information and acquire skills that will protect them from new HIV infections and AIDS. My dear adolescents and young people, you are the key audience today. As you lead this meeting, ensure that you have comprehensive HIV knowledge-based facts, because a lot of misconceptions exist amongst yourselves, which may lead you to acquiring HIV. Rise and speak your minds. Engage us as your partners as much as we are your parents that have your best interests at heart. My door is always open for the youth, knowing that you are the backbone of this nation. As I conclude, I would like to reaffirm my commitment to provide the necessary leadership in creating awareness and promoting the health of our young people. Let us join hands to speak about the factors that increase the risks of young people getting infected with HIV and the barriers that limit their access to services. May I now take this opportunity to thank the Ministry of Health and cooperating partners for facilitating this event as part of the Free to Shine campaign targeting adolescents and young people. To the nation at large, I encourage you to start free, stay free, AIDS free, COVID free, and please mask up. I thank you all, and may God continue to bless our adolescents and young people, and indeed all the citizens of our great nation. Amen.
You can liaise with Tina. They can get the recorded.
Okay. Good morning, everyone who's joining in for the National Adolescents HIV Start Indaba 2021, and that was a speech read by our First Lady. And also, we would like to welcome you once again for this surge. And just to give an announcement, for now we'll be moving to another Zoom link, which is going to be shared in the chat. I think it's being shared right now, so that we could accommodate as many people as possible.
You can